do. I'm not there, but I went back.
Live now. That I believe that we are. I believe that we are. So let's just say that we are. I believe that we're live, and this is a special edition of the Literacy Hour. As a matter of fact, I'm just so excited this evening because I get to co host again the Dr. Frank McCune Health and Prosperity Show. Good evening, everyone, and welcome to the show. I want you to know that the information shared during the Dr. Frank McCune Show, either by the host or guest, is for educational purposes and does not constitute medical, legal, financial, or tax advice. For specific advice applicable to your situation, want you to please contact a licensed certified professional. Good evening and welcome to the show. Thank you for tuning into yet another episode of the Dr. Frank McCune Health and Prosperity Show. Brother Michael Thompson and Sister Gloria McCune are off today. Brother Michael is working the polls, and we're just so grateful for his service. I'm your guest host again, Dr. Kentrell Liddell, the host of the Literacy Hour with Test Taking Solution. It's heard right here on WMPR 90.1 FM every Tuesday morning from 7 until 8. That's 7 to 8 a.m. We also stream live on our foundation's YouTube channel. You just go over to YouTube and type in Test Taking Solution Foundation, and you'll find us right there. We invite you to subscribe to the YouTube channel if you're not in range of WMPR 90.1 FM, over 1,000-watt radio station. So this evening's episode, of course, is going to be jam-packed, it looks like here. This morning we discussed education and enhanced our education literacy. Our word of the day this morning was abstruse, and so it's most befitting that this evening I share that word with all of you. Abstruse, hard to understand. That's what it means, abstruse. And we teach our scholars over at Test Taking Solution when some words are hard to understand, we link them to words that are pretty common for us, right? And so abstruse, we link that to moose. We say that Mike the Moose is very abstruse. His friends find him to be abstruse. That's Mike the Moose. Mike the Moose is abstruse. He's hard to understand. I tell you, if we have a talking moose, then we all got a problem anyway, but that helps us to remember the meaning of the word abstruse. Hard to understand. And I'm going to use it in a sentence for you this evening. Chemistry is an abstruse subject of study for many students. Chemistry is an abstruse subject, complex, difficult to understand, but not if you attended Tougaloo College, or I'm sure any other HBCU. And I see you, Jackson State. I'm a Tougaloo grad, and got a lot of love for the other HBCUs, and majored in chemistry over there. At the time, it was quite abstruse, but Dr. McGinnis and all of my other faculty members broke it down for me. Scientists had many abstruse theories about atomic interactions. Abstruse, hard to understand. So I want to encourage you to try to use that word. We've got some more hours left in the day now, and you might have a reason to use it after a while. This is a special day in our great capital city and the surrounding areas, literally all over the country. There are races everywhere. New York City, Virginia, they're closing their polls. New Jersey over there right about now, and the results are coming in. The call-in number this evening is 601-714-8378. Let me give you that number again. It's 601-714-8378. Would love to interact with you and engage with you about the topics of the day. I did share with the team that I'll be discussing the SNAP benefits as well as the upcoming legislative committee meeting on this Thursday. So those are the two main things we'll be talking about this evening, and would love to hear what you think about either of those topics. All right, looks like we already have a caller. All right, caller, you are on the air. What is your question or comment this evening?
Good evening. I wanted to use that word, your
Abstruse.
word for the day.
Yes, that.
Abstruse. Okay. My election, let me see, how can I put it? The election process was abstruse today.
Oh,
If you're
wow.
voting at Chestang Middle School, they have no information that's telling you where to go. So you have to actually go around by McWillie to that Midtown, the little school that right there off 55. That's
Okay.
where people who voted at Chestang, that's where you're voting tonight.
Oh, that
So it
was
was very
so.
confusing. No information of no, flyers telling us we're not voting here at this time. So it was abstruse.
And
How about that?
that is perfect. And I'm so sad that you found your polling situation abstruse today. But I'm glad
Yes.
you figured it out. It seems like you are not only very engaged, but quite professional and intellectual. Boy, I love those kind of phone calls. So you call back anytime
And
you.
we love you. We love y'all. Love y'all. Love listening to you in the morning. So you're on my way to work and it's perfect.
Oh, thank God for you, and thank you for your encouragement. You be careful out there, okay?
Yes, ma'am. Y'all have a blessed night. Bye bye.
Same to you, ma'am. Oh, what a beautiful spirit. Listen, you wouldn't have had that problem with Brother Michael Thompson. I mean, he's been working his pole. He told folks early this morning where to go so that things would not become abstruse. Ding, ding, ding. There's that word again, abstruse. Hard to understand. And so we want to continue to expand our vocabulary. We're going to do it as adults. We're going to help our scholars, our young people to do it as well. And it's just so important. Listen, Mr. Sherry Jones has been holding things down in the morning time over there at WMPR. He's been handling things, yes, because Brother DJ Larry Armstrong is still absent. We're praying for him and his wife as they stand watch at the bedside of their son, who is in hospice at this time. So, for those of you prayer warriors out there, I just really want you to lift the family up and keep them in your prayers. Um, Boy, Brother Armstrong serves in so many places for so many people, doing so many things, and it's sometimes in our own times of need when it's somewhat challenging for us to reach out to others for help. Well, you know when we need help, so just help. And at this time, um, they can use our prayers. A caller earlier this morning during the Literacy Hour show said that God is in control. And I'm so in total agreement with that gentleman. And again, thank the young lady for calling in just now. She helped you all out now. And you still have time to get to the polls. So don't slow around. Go on and do what you have to do. Today is the day of the District 26 State Senate special election. We should know later in a few hours if there will be a runoff. The different platforms have been shared by the candidates themselves. Opinions have been shared by many who either know the candidates, have worked with the candidates, and by the candidates themselves. Now, again, I love to hear your thoughts about it, but let me tell you what I think. I normally keep my thoughts to myself, but hey, I'm standing in for my brother Michael Thompson and Sister Gloria McCune, so I think they'll allow me just a little grace this evening. So here's what I think. I don't want to see candidates just around election time. I need to see them out in the streets, at events, at churches, uh, at the schools, throughout the year. I need them doing, you know what? Councilman Kenneth Stokes could just go and write a book on it because I'm always just so very impressed and just in amazement about how he serves the community. Um, Councilman Hartley, just some visible people. Tina King Clay. I was over at an event at Jackson State University, just uplifting the youth over there. And lo and behold, there she was. Not a shocker at all, because there are just some folks who just genuinely love to serve other people. Those are the folks I want in these seats. You can be as intellectual and as witty as you want to be and resourceful, and that's fine. But if you got a bad attitude, a bad spirit, and cannot connect with folks and don't have many other warm connections to help move our city and our state forward, then you need to stay at the house. Don't even know why you got in the race. And I'm not talking to anybody in particular. I'm just saying those are my sentiments. Kentrell Liddell. And if you want to put the MD, the MBA on the end of it, you can, but you don't have to. Just call me Kentrell. Listen, if eligible, I sure hope that you took the time today to go vote. If you have not done so, you still have time to vote. We spoke a little bit about that this morning. It is so important that you do get out to exercise your right to vote. We've talked to folks in the past, and the voter apathy just blows my mind. Listen, you won't miss it until you lose it. Don't ask me how I know. We'll be on this show all night. But I just want you to understand and to really realize that there are some folks dead and buried 6 feet under, and where they tell me they don't put them 6 feet no more. They saving space. So I don't know what they're doing, 2 feet, 4 feet, but they're putting them under. And there are folks who are down under after they have shed blood, sweat, and tears just to get our people the right to vote. And then some of us are eligible and sitting at the house talking about my vote ain't gonna matter no way. They're gonna do what they want to do. The numbers matter. Your vote does matter. You help to drive up the numbers. We need you to get out to vote and to vote your interests. Vote what you really care about for the platforms that you care about. And then on the flip side of it, once the voting and the elections and all that's over, help hold the candidates accountable. Help hold them accountable. I know how it is. I know some of them are untouchable. You can't find them after the election. Got to try to run them down. They got 2 or 3 cell phones and they answer the ones they want to answer. I know all about all of that. But then there is a God who sits high and he looks low and he sees everything and he knows everything and he knows their hearts. And I would tell you that during this season, we have some people running who really care. They don't have to run. They got families. They got children. They got, very amazing careers. They don't have to be running to be a public servant, having you all in their business. They don't have to be running, but they chose to run. Somebody called in this morning and said, Dr. Liddell, look, the reason I don't vote is because we got a bunch of losers that are running. And I push back on that. And I'll continue to push back on it. They're not losers, none of them. You may not like their stance. You may not like their position. Listen, you're not going to like everything about somebody, and somebody ain't going to like everything about you. It's all right. You know why I know it's all right? Because I heard about, I didn't actually see it, but I believe it with all my heart. They hung a man who had done no wrong. They didn't like him. They didn't like the good that he was doing, but he did it anyhow. And then later on the other side of that thing, they realized and figured out that he truly was, and he is, the Son of God. I'm so glad about it, and that's why I can sit here this evening. That's why I can get up every morning and run home, because I know that God lives. I bet you they found out that they didn't have to like him so long as God loves him. My pastor preached on Sunday. He said that After John the Baptist baptized Jesus in the pool. Now, I know I told you I was going to talk about SNAP and that public hearing coming up, but you just got to just go with me on this because I'm being led to share this with somebody, and obviously somebody needs to hear this. It might be you. But he said that the dove quickly, immediately came down from heaven and lit on top of Jesus. This is after he's been baptized now. And my pastor said he lit on top of him because he was already in him. God was already in Jesus. Either one, he was full. And so he lit on top of him. And that was God's way of showing the whole world how special Jesus Christ really is. He said, "This is my beloved Son, in whom I am well pleased." So don't you worry about what folks say about you, the naysayers and the nitpickers and the this and the that. It ain't between you and them anyway. It's between you and your Lord and Savior. And if you're not a Christian, it's between you and your God. I respect your right to choose, and I need you to respect mine. And so this evening, get out to vote. You still got time. The polls don't close until 7 p.m. Any voter in line at 7 p.m. is legally entitled to cast a ballot. There are not many other privileges afforded to us greater than the right to vote, the right to cast a ballot, the right to let our voices be heard. It's free to cast a vote. We don't have to speak to anyone. Just walk into that booth and unleash the power of the vote. You still have time. Again, thanks for tuning into the Dr. Frank McCune Health and Prosperity Show. The late Dr. Frank McCune was my mentor, and he was my friend. He was an exceptional physician who really cared about the people he served, and he was the one who introduced me to the medium of radio. I was just a family medicine resident physician over at the University of Mississippi Medical Center when Dr. McCune called me one day and said that he wanted me to co-host a show with him a few days a month. I prayed about it, and as the Lord would have it, with him being such a good man and a servant of his, he allowed me to do that. And then whenever he would need to be out of town, he would ask me to host the show. And man, that seems like eons ago. I know that he would be so proud to know that I'm sitting here right now, guest hosting the show that still bears his namesake today. I would like to think that he's resting in heaven right now, and I know I'll see him again someday. So I want you all, just for a moment, just think about someone that you've lost this year. And remember a good memory, like the one I just shared with you. Let's just take a moment. All right, you all. Well, let's talk about SNAP a little bit, okay? My team is on top of it. They shared with me some very troubling stats this evening, something that blew my mind because I am guilty. I'm guilty of thinking that us Black folks utilize these benefits, these social services more than any other group. I'm guilty. Are you guilty? Because the reality of it is that there are more white people utilizing SNAP than there are African Americans. As a matter of fact, the data is out. About 37% of white Americans are on SNAP, 26% African American, 16% Hispanic, 3% Asian, about 2% Native American. And you know me now. I don't like to talk out of the side of my neck. I don't say anything I can't back up. The information is out. The United States Department of Agriculture, they report on this. Now, I tell people bad data in, bad reports out. If it's wrong information, they got it wrong, but they are reputable federal agencies. So we want to believe that we can trust the information that's coming out. But they provide a picture of who actually participates in the SNAP program. And for those of you not familiar with SNAP, it's an acronym and it stands for Supplemental Nutrition Assistance Program. Supplemental. That means that it's going to add to what you already have. It's a supplement. You know, like you may go to the store and get a vitamin supplement. All right. So it's not intended to fulfill your entire meal. It's intended to supplement. Supplemental. It's going to complete or make an addition to something. It provides extra support. It's supplemental. We have supplemental insurance. We have supplemental instruction in education. And in government and law, you got supplemental applications. Anything that is intended to meet a need is supplemental. So the USDA oversees this program. It doesn't seem to you that the USDA oversees a lot of social programs, a lot of grant programs. The United States Department of Agriculture, they oversee a whole lot of things. Their hands are all in the farmers' loans, and I mean, and I understand that's agriculture, and I guess I understand this too. It's food. But, I want to hear your views about this SNAP program as well. But their latest report covers the fiscal year 2019. And they released it March of this year. You see, sometimes data is behind. It's retrospective data. It's data that they collected from in the past, and they are now getting to a point where they can report on it either in aggregate as a few years in a row or as an individual year. You know, we talked about, and we'll talk about here in a moment, how the infant mortality rates that we are all up in arms about are the rates from 2024. The rates from 2025 haven't even been reported yet. Wow, we have another month left in the year, and then the reportings will occur. But boy, let me tell you what's really powerful. Real-time data. And that's what our Mississippi State Department of Health has at its fingertips. It has the data in real time. That's why Dr. Daniel Etney, our Chief Health Officer, went ahead and issued that public health emergency. He didn't like what he was seeing in terms of the data. So his analysis was such that it mandated some action that he took, an action that some of us out here are supporting him in, and making sure that we raise awareness about an issue that until now was pretty silent. Weren't talking about it. Got committees over here working on it, and meeting groups over here working on it. But nobody was raising the alarms. Well, we're talking about it now. And the Black Legislative Caucus is taking a lead on this. And public health committees legislatively are taking a lead on this. This is crucial. Very important in our state. So with SNAP, the United States Department of Agriculture issues a series of annual reports on the demographic and economic characteristics of households and individuals who participate in the program. And their reports provide some useful information. I hope that advocates and policymakers and other stakeholders utilize these reports to make informed decisions. So some of the key report findings, I won't read the entire report to you, but I have read it, and I will share with you some of the key findings that I think are important for all of us to know. SNAP targets those in greatest need. Among those participating in the program, most of them are children. And that's why this pulls on our heartstrings so much, this ceasing of SNAP benefits. I know they said they're going to start some of them back and a portion of them, but man, still children will be impacted, elderly persons, individuals with disabilities. In fact, 86% of all SNAP benefits go to households that include a child, elderly person, or person with disabilities. In addition, about 92%, that's a whole lot now, 100% is a whole. So 92%, that's close to a whole. That's close to nearly all of the SNAP benefits go to households with incomes at or below the federal poverty line. And there are a lot of reasons why folks' incomes are below the federal poverty line, and we can have an entire show on that. Because now I know for a fact that some people can work all their lives, all their adult lives, from age 18 on upward. I know folks in their 60s still working. You can still, people work. I know folks in their 70s who are working. Why? Because in some instances, and probably in many, it hasn't been studied, someone needs to look at it. In many instances, a job is a scam. You can work nearly all your life and not have anything to show for it. In other words, living from paycheck to paycheck just to survive. Not thrive, but to survive. And so SNAP benefits help to supplement, help folks to get over the hump, help folks to take care of their children, the elderly, the people with disabilities. Now, SNAP recipients represent different races and ethnicities. I shared with you that there are about 37% white people on the program, about 26% African American, 16% Asian, 16% Hispanic, okay, and 3% Asian, and 2% Native American. About 16% of participants categorize their race as unknown. You see that? So that's what also makes the numbers not as accurate as they could potentially be, because some people say, I'm not going to report my race. All right, so then you skew the numbers. You cause us to not really know the true answer, but the breakdown nonetheless is nearly the same. That about 37% of all the SNAP recipients are white. About 26% of all SNAP recipients are Black, and so on and so forth. So we're not the group of people utilizing the program the most. And that's contrary to popular belief. Here I am with all my degrees and credentials, and I thought that we were. Why? Because I had been fed that. I had been told that. I had heard that. I just get sick and tired of folks talking out of the side of their necks. Don't talk if you don't know the information accurately. You mess folks up. You brainwash us. You have us thinking one way when we should be thinking another way. Help to inform by telling the truth. And if you don't know, just say you don't know. But this data from the U.S. Department of Agriculture that administers the program, I think I'm going to trust it. Many SNAP households have earned income. Almost 1/3 of SNAP households have earned income, though only 20% of households have gross monthly income that's above the federal poverty line. The average SNAP household's monthly gross income is $872. That's gross. That's what you bring home. That's what you make in your paycheck before any taxes and expenses come out. Now, after all of that stuff comes out, then your net income tends to be, for the average SNAP household recipient, around $398. Now, that's what the data says. And in this day and time, who can live off of $398 a month? It's almost an atrocity that someone then would take away such an important safety net, such an important supplemental program, when you know this data right here, you know that people aren't able to make a higher gross income. Now, next Tuesday on the Literacy Hour, I will be mentioning, because we'll be talking about health literacy, and I like to talk about the VA health system. Our VA Sonny Montgomery Hospital here in Jackson is one of the top hospitals, top VA hospitals in all the country. And we'll talk about that and how they got that title. But I mentioned the VA because I thank God that our veterans with disabilities, people on Social Security, get a cost of living adjustment every year, a COLA, a cost of living adjustment. And next week we'll talk about what those rates are, so people will have an idea. If you don't already, you should have received notifications, emails, etc. But thank God someone thought to increase these groups of people on an annual basis. But there are a lot of us who don't get an increase on an annual basis. Those of us working regular jobs or listen, employers don't give a raise every year just because you have a wonderful evaluation. I know what I'm talking about. I didn't have to hear about it. I didn't have to read about it. Some things you know because you've experienced. So I'm thankful that somebody helps to adjust these fixed incomes on an annual basis. But the SNAP recipients' monthly gross income is around $872, and their net income is around $398. And I don't hear of anyone saying you're going to get more because the cost of living went up. That's few, far, and in between for a lot of us. You don't see an increase in your pay, but the bills go up. Oh yeah, get notices from Entergy, Atmos Energy. You get notices from your internet provider. You get notices from your lawn care. So you get notices that everything else is going up. Your accounting systems, QuickBooks and other software and this and that. They're going up. But your pay? So for those of you who want to argue that, well, they should get a job, the type of job matters. There are still some jobs that don't pay a livable wage. That's not the recipient's fault. We got to stop victimizing and blaming people for their lot in life. The Bible says the poor will be with us always. I think it is our duty, our obligation to help those in need if we can do so. Stop being mean and cruel and vindictive, and either help them, but certainly don't hurt them. If you can't help them, then just don't hurt them. The vast majority of SNAP households do not receive cash welfare benefits. The USDA says only 4% of all SNAP households, that's a very tiny percent, and only 10% of those households with children receive actual cash welfare benefits, and that's through the Temporary Assistance for Needy Families, the TANF program, which we've heard a lot about in our state. A topic for another show. SNAP fights poverty, though. More than 9% of participating households move above the federal poverty line when SNAP benefits get included with their gross income. Isn't that where we want people to be? Above the federal poverty line? So I just want us to be aware that the SNAP program is USDA administered. You have any comments about what I've just shared, you can certainly call in 601-714-8378. Otherwise, I want to share with you a letter that the Mississippi Legislative Black Caucus wrote to our Honorable Governor Tate Reeves. Its subject matter was an urgent request for state of emergency declaration or a special session to protect SNAP beneficiaries. Dear Governor Reeves, I hope this letter finds you well. I'm writing to you on behalf of concerned constituents regarding an imminent risk to the Supplemental Nutrition Assistance Program beneficiaries in Mississippi. Recent data and projections indicate that a significant number of Mississippians, potentially up to 400,000 individuals, may experience disruptions in their SNAP benefits. Of particular concern, 58% of SNAP recipients are children and elderly individuals who are most vulnerable to food insecurity. Additionally, 38% of recipients live in households with at least one working member, underscoring that many families are already contributing through work while facing ongoing economic challenges. Given the potential for widespread hardship among families, seniors, and children, we respectfully request your consideration of declaring a state of emergency to mobilize resources and coordinate relief efforts for SNAP beneficiaries, or calling a special session of the Mississippi Legislature to urgently address SNAP-related funding, administrative processes, and any policy adjustments needed to prevent benefits interruptions. The primary objective of any such action would be to ensure continued access to nutritious food for the most vulnerable Mississippians and to provide clear, timely information and support to families navigating the SNAP system during this period of potential disruption. All options must be explored. We recognize the many demands on your office and the state budget. However, ensuring that no Mississippian faces hunger due to gaps in SNAP delivery is a critical public health and humanitarian priority. Thank you for your attention to this urgent matter and for your continued leadership on the well-being of Mississippi's families. I'm available at your convenience should you wish to discuss this further. Respectfully, Kabir Kareem, Chairman, Mississippi Legislative Black Caucus, State Representative, House District 41. Very well written letter. Really, truly appreciate the Mississippi Legislative Black Caucus for taking this initiative to write our governor this letter. And I don't know if the governor has officially responded, but he did share a social media post shortly after that letter was received, I guess. Shortly after it went out the door. I don't know if he got it in hand. I don't know if he read it. I don't know if he officially responded to it. But let me tell you the date on the letter. October 28, 2025. That's the date of the letter. This social media post came after that. And in this social media post, Governor Reeves types, quote, Democrats in Washington are evidently more interested in providing free health care to illegals than a safety net for poor Mississippians. They evidently hate Trump more than they like their constituents. There is sadly no simple way for state government to just step in and pay the hundreds of millions of dollars in harm that this shutdown by the Washington Democrats is causing. And then Governor Reeves announced, I think it was on Friday, he announced on Friday that he requests waivers to encourage healthier purchases while using SNAP benefits. That was October 31st, 2025. Yes, he sent out a press release, an official press release from the office of the governor. It says Governor Tate Reeves announced today that he has requested a waiver from the United States Department of Agriculture, USDA, Food and Nutrition Service, to ban the purchase of unhealthy processed foods and beverages using SNAP benefits. Additionally, Governor Reeves requested a waiver allowing the purchase of hot prepared chicken using SNAP benefits. I love to hear what you think. Governor Reeves went on to say welfare benefits are a hand up for those in desperate temporary need. When taxpayers fund these things, they do so strategically. They're trying to help their neighbors into a better life, a more fulfilling one. That means a job you can be proud of and a lifestyle that is healthy on a physical and a spiritual level. I'm reading to you the press release from the office of our governor on this past Friday, Halloween. Quote, in a nation that is printing money daily just to make our debt payments, it doesn't make sense to throw your tax money at anything other than the true necessities. So it makes no sense at all to fund sugar instead of hearty, nutritious meals. That's why we're amending our food stamp rules to allow good sustaining food like rotisserie chickens and disallow sugary candy and drinks. Disallow. That means to not allow. Our SNAP benefit rules will be updated to not allow, to refuse to allow, to disallow. He said to disallow sugary candy and drinks. If the first ingredient is sugar or corn syrup, it won't be available with taxpayer money anymore. This has been approved by the Trump administration in 12 states, and I expect Mississippi to be the next. It's just common sense. Once Governor Reeves' request is approved by the USDA, processed foods that list sugar, cane sugar, corn syrup, high fructose corn syrup as the first ingredient will be prohibited for purchase using SNAP benefits. This excludes granulated sugar, raw sugar, and other single ingredient sugars used for cooking and baking. You can get raw sugar, to cook with and to bake with. But should the USDA approve Governor Reeves' request, you won't be able to buy anything that lists sugar as the first ingredient on that item with SNAP benefits. Beverages that list carbonated water and sugar, cane sugar, corn syrup, or high fructose corn syrup as the first two ingredients will also be prohibited for purchase using SNAP benefits. Beverages that list aspartame or other low or non-caloric sweeteners as the first two ingredients will remain eligible for purchase. Once approved, hot prepared chicken would also be eligible for purchase using SNAP benefits. Now, I thought that people could purchase that now. Do you see how we learn something new every day? And maybe you knew this. I just didn't know that people couldn't purchase hot meals with the SNAP benefits. And so now I applaud the governor for adding that. We need that. We want people to be able to purchase prepared chicken. This includes items like rotisserie, non-fried, non-breaded chicken. Mississippi will also collaborate with the Double Up Food Bucks program. Now, I've never heard tell of that. The Double Up Food Bucks program. Have you heard of that? If so, call in and tell me all about it. But he said that Mississippi is going to collaborate with the Double Up Food Bucks program. And that's going to encourage and increase the purchase of fresh fruits and vegetables. Ooh, I love that. When hot prepared chicken is purchased. Wait a minute now. Only when hot prepared chicken is purchased? Governor Reeves' waiver requests are in line with the Trump administration and the Health and Human Services Secretary Robert F. Kennedy Jr.'s mission to make America healthy again. You have any questions about the press release, don't call me. Call the governor's office at 601-359-3150. 601-359-3150. So we'll try to keep you updated about the progress on the SNAP benefits, but I want to turn my attention now to the Public Health and Human Services upcoming meeting this Thursday, November 6th at 9 a.m. It's going to be in that beautiful room, 113, there in the Capitol. And sometimes parking can be hard to find, particularly if you get there a little late. You want to get there early. Now the hearing is going to start at 9 a.m. and it's a hearing about infant mortality. You see, last Thursday, the Mississippi Legislative Black Caucus hearing was on maternal health. And you can't really talk about maternal health without talking about infant health. So we got an earful about both topics, and rightfully so. So now this upcoming Thursday, the topic is going to be about infant mortality. Infants dying in our state at numbers and rates that are higher than all other states across the country. And we just can't have it. You know, back on August 21st, 2025, all right, this year alone, the MSDH declared a public health emergency on infant mortality. And we brought it to you on the Literacy Hour. Dr. Etney also shared, and he was interviewed by several of our shows on WMPR 90.1 FM. He educated us. He made sure that we were aware. And that PHE, the public health emergency, was in response to the rising infant mortality rates across the state. Mississippi's 2024 data, that's what I want you to be clear on. We don't know where we are right now. I bet you Dr. Etney knows, because he gets that data real time. You know, he gets it in such a time where he can analyze it and determine whether we're moving in the right direction or not. But in 2024, all of that data shows the overall infant mortality rate has increased to 9.7 deaths per 1,000 live births, which is the highest in more than a decade, right? In Mississippi, 3,527 babies. That number is seared on my brain. 3,500 plus babies have died before the age of 1 since 2014. That's a lot of children. That's a lot of children who, but for them dying before they reach the age of 1, could have gone on to lead productive lives as citizens of our great state. State Health Officer Dr. Daniel Etney stated, quote, "Too many Mississippi families are losing their babies before their first birthday." This is deeply personal to me, not just as a physician, but as a father and a grandfather. Every single infant lost represents a family devastated, a community impacted, and a future cut short. We cannot and will not accept these numbers as our reality. What a bold statement, and I love it. And we all should be right there with him that we cannot and we will not accept these numbers. Now, the only thing that got me was in this press release, they didn't put the number of African American deaths. They say that our infant mortality rate has increased to 9.7 deaths, but then Dr. Etney, you shared with all of us verbally and virtually during the various meetings and press conferences and radio shows that it's even worse in the Black community. 15.2. Man, I would have loved to have seen that typed out in the press release. That is mind-blowing. That we as African Americans are losing our babies at an even greater rate than the already high rate. So declaring a public health emergency is more than a policy decision. It's urgent. It's an emergent matter. And when something is emergent, that means that it is life or death. We're Mississippi. We're Mississippi strong. We have the knowledge. We have the resources. Resilience is our middle name. We know all these things. But it's going to take everybody, policymakers, healthcare providers, communities, families, all of us working together to give every child the chance to live. But if the mamas aren't healthy, then it's going to be difficult for the children to be healthy. And I'm talking about physically, mentally, spiritually. That postpartum period, that period after a woman has delivered a baby, that's a really sensitive and tough time. The experts at the hearing on Thursday attested to it. Infant deaths These are the ones we're talking about occurring within the first year of life. And the leading cause includes congenital malformations, preterm birth, low birth weight, coming here too little, coming here too soon. It's like baking a cake in an oven. If you don't let that cake stay in there long enough, you know that cake is going to fall. It's going to be flat. It's not going to have the things that it needs to survive. Also, sudden infant death syndrome, SIDS. So one way to reduce the infant mortality is to improve maternal health. That means we must have better access to prenatal and postpartum care. We don't have an OBGYN in every county in our state, and we probably never will. So it's not okay because we got women in every county of our state. We have children in every county of our state. Therefore, we must have access to prenatal and postpartum care in every county and every state. In every county in our state, we gotta have it. Healthy women of childbearing age are more likely to have healthy pregnancies, which then would turn into healthier babies and healthier lives for these babies. Infant mortality is a multidimensional issue. And that's why I'm glad to see that the leaders that be are leveraging all sorts of avenues and initiatives and resources. Okay, now start putting them into action. And then let's start studying, analyzing to determine if what we are doing is working. We don't have time to wait. We got to start putting some of these solutions in play. Public health emergencies don't just relate to infectious diseases, you all. I want you to know that they relate to public health issues, and this is a public health matter. There are going to be some great experts speaking on this Thursday. If you can get there, it starts at 9 a.m. Show up. Our Mississippi maternal mortality numbers are becoming less. You know, the maternal, now that's the mama's mortality. The mama's dying, that's becoming less. 40 to 50 deaths per year. That's still 40 to 50 too many, but it's less than what it had been. But the infant mortality numbers, man, about 300 to 350 infants dying per year right here in our beautiful Magnolia State. Our state's chief health officer, Dr. Daniel Etney, spoke about this crisis at length. He's been speaking about it, speaking up, speaking out. He said we're losing more children in infant deaths than we are to RSV and COVID combined. Now, I want all of us to be clear that the only information the CDC, the Centers for Disease Control and Prevention, has is what the states send to them. So our state has the data far sooner than we actually hear about it from the CDC. So the numbers that Dr. Etney and his team share with the CDC will be reported nationally. You know, I can't wait for the 2025 data to be reported, because this is just shocking. Back when the CDC published its 2022 data, Mississippi led the country then with 7.95 infant deaths per 1,000 live births. That was 2022. We were in the lead. And now we've ballooned up to 9.7. You know, it makes me wonder who's at the wheel, who was watching this, what happened in 2022 when we were leading? Why wasn't the alarm raised then? And then 2023, why we didn't start implementing some things and watching and studying to see if what we were doing was working. Then 2024, well, here we are in 2025 and we have an emergency, because there are no signs of these rates slowing down. We got a problem. Houston, we have a problem. The numbers for African Americans are even more startling. Yes, the other component to this public health emergency is that it is impacting the African American community far more substantially worse than any other demographic. We were at 12.4 infant deaths per 1,000 live births. And now we've ballooned to more than 15. That means that 1 out of about every 67 African-American children born dies before their first birthday. That should be horrifying news for every Mississippian. Now, I'm waiting on some letters to be written about that. I'm waiting on a word to come from on high about that. I know SNAP is extremely important, but we are losing babies at a rate unimaginable. And we're one Mississippi. We're all in this together. The child who is lost could have become a teacher, a doctor, a lawyer, a bus driver, a restaurant owner. You name it, the list goes on and on. Dr. Etney is building an OB system of care. And all I'm asking everybody is to include that cast aside group of folks who live under 99-1935. That's a statute here in our state. We got doctors and dentists sitting on the sideline, fully prepared, residency trained, ready to go. We need a system of care that is comprehensive and all-encompassing. We need access in every single county in our state to prenatal care and postpartum care. High quality for both, absolutely. Raising awareness is what we're going to continue to do, because it's not just one life being impacted. The death of that one child affects an entire community: mothers, fathers, cousins, brothers, sisters, grandparents, neighbors, church members. It's alarming news. And it's not about politics. It's about doing what's right. You know, Representative Kabir Kareem included a statement in his letter. He said that it's a critical public health and humanitarian priority. That's what he said about the SNAP benefits being restored. It's critical public health. It's a humanitarian priority. Well, I will venture to say the same is true regarding implementing a comprehensive, high-quality OB, that's obstetrics, system of care. One that will help to positively impact maternal health and infant health in our state. I know we can do it because we're Mississippians. We can do this. I learned something doing that last hearing that I just absolutely have to share with you, because Dr. Keisha Bell Ketchens did a phenomenal job of presenting it. She said that Black women account for about 80% of preventable deaths, and inequities in care is not biology driven. It's driven by some other stuff, you see. The inequity in care, the folks not being listened to, folks not having access to high quality care, that's what's driving these outcomes, not folks' biology for the most part. And then, man, when she shared with us that mental health in the postpartum period, mental health issues being experienced in the postpartum period is now among the top causes of maternal mortality. You see? So we're going to need an all hands on deck approach, a comprehensive approach. And I hope that you will join me on Thursday there at the hearing. And if you can't come, just continue to pray that our state can do better. Thank you so much for listening to the Dr. Frank McCune Health and Prosperity Show. I think the polls have closed now. And so let's see what our night will be, whether things will be abstruse, hard to understand, or whether we'll gain a greater understanding by and by. Thank you so much. And you have a great rest of your night.
For the past 1 hour, you have been listening to the Literacy Hour with Test Taking Solution and your host, Dr. Kentrell Liddell, MD, MBA. We are located at 2104 Thousand Oaks Drive in Jackson, Mississippi. Visit us on the web at www.testtakingsolution.com. Join us each Tuesday from 7 to 8 a.m. for another life-changing conversation here on our podcast live stream at affiliate stations.
And so that's what we have to do. It's crazy.